Hello YouTube, I'm Dr. Fox. Today, I'm talking about exercise and pregnancy. It used to be the case that pregnant women were advised to cut out exercise. These days, we are more informed on what is healthy for a pregnant woman, and your doctor will recommend regular physical exercise as part of a healthy pregnancy. Exercise benefits everyone, including pregnant women, being crucial to achieving a robust lifestyle alongside whatever diet you may have. Positive results from exercise include the following things. First, promotes healthy weight gain during pregnancy, helping your body be strong and fit for labor and birth. Third, improve your mood and self-image. Fourth, avoiding constipation. Last, avoiding backache as much as possible. Okay, you may be wondering if it is safe to exercise during pregnancy. If you're healthy and your pregnancy is normal, it is safe to continue or start regular physical activity. You will be no more likely to experience premature birth, miscarriage, or robust weight as a result, though to discuss with your healthcare provider and perinatal team in case they do have specific concerns. Okay, next question would be what complications can prevent pregnant women from exercising? Certain scenarios do result in pregnant women being asked to cut down on or avoid exercise, though this does not mean immobility in the majority of cases. Examples are high blood pressure, preterm labor, weakened cervix, ruptured membranes, growth-restricted fetus, preeclampsia, multiple pregnancy of triplets or more, placenta previa after the 28th week, severe anemia, vaginal bleeding in the second or third trimester, uncontrolled type 1 diabetes, heart or lung disease, thyroid disease, and so on. Okay, then let's think about how to exercise. So start easy and progress gradually. Physical activity can make you feel better and be beneficial for both you and your developing baby. The decision to be active during pregnancy may be the first step toward a long-lasting healthy way of life for you and your family. Just make sure you start slowly and consult your doctor in case they have any particular advice for your own health and condition. Walking and swimming are always good choices for mild exercise, and it is okay to start with short attempts each day before deciding to increase your activity. Before starting a new physical activity program, you should talk to your healthcare provider on whether it's wise or should be managed in a certain way. Okay, then, if you are a naturally active person, how much should this change because of pregnancy? The best approach is to continue as you are, but look to make changes when your body tells you to do so. Your doctor can advise if anything in particular might be dangerous, but this is a great time to get in touch with your own biology and pay attention to what it is telling you. If something feels too challenging, then it is likely not a wise choice. Okay, next question. What are some safe exercises you can do during pregnancy? Healthcare providers often advise the following. The first thing is walking. Sometimes the simplest exercises are the best, but do you really do enough of this with your days? Brisk walking gives a total body workout and is easy on the joints and muscles. Second, swimming, as this provides more benefits to your muscles and joints than many people realize. Also, the likelihood of injury during this choice of activity is greatly reduced because your weight is supported by the water. Stationary bicycling, which may prove a better choice than outdoor biking as your body gets bigger. As long as the bike is still, you can cycle without fear of suddenly becoming unbalanced because your center of gravity is changing. Okay, next. Modified yoga or Pilates. Yoga reduces stress, improves flexibility, and encourages stretching and focused breathing. There are prenatal yoga and Pilates classes designed for pregnant women. Indeed, professionals specialize in classes just for pregnant women in particular, taking on all stages to help with breathing and flexibility. Some should be avoided, for example, any that leave you on your back for long periods of time. Some sports you may be able to carry on if you already know them extensively. If you are an experienced runner, jogger, or racket sports player, you may be able to keep doing these activities during pregnancy. Discuss your sporting priorities with your doctor for confirmation. Okay, you may wonder, to what extent should you exercise as a pregnant woman? Pregnant women are advised to undertake around 150 minutes of mild to moderate exercise a week. An aerobic activity is one in which you move large muscles of the body, like those in the legs and arms, in a rhythmic way. Moderate intensity means you are moving enough to raise your heart rate and start sweating. You still can talk normally, but you cannot sing. Examples of moderate intensity aerobic activity include brisk walking and general gardening, raking, weeding, or digging. You can divide the 150 minutes into 30 minutes workouts on 5 days of the week, or into smaller 10 minutes workouts throughout each day. Newcomers to such a lifestyle need to begin with caution. Get to know your capacities, even if it means adding 5 minutes a week until you reach the optimal target. Keep monitoring your weight, especially if you are very active. Some women who exercise lose weight during the first weeks of pregnancy, which can mean you need to take on more calories. Okay, my next advice: don't go overboard. You should be able to carry on a normal conversation during physical activities. If you're feeling more tired than normal, take it easy and rest for a day. Okay, how can you judge if you've done too much? If your body is telling you to stop, then listen to it. If you still feel tired, give yourself a break for at least a day. Also, check for any of the following results, which should result in a visit to the doctors: persistent contractions, vaginal bleeding, pain in the back or pubic areas or in the abdomen, sudden swelling of the ankles, hands, or face, feeling dizzy or difficulty breathing, exhaustion, finding it challenging to walk, changes in usual fetal movement, swelling, pain, and redness in the calf of one leg. What precautions should you take when exercising during pregnancy? Certain safety measures women should consider include the following things. First, water intake. It is always important to be well hydrated during pregnancy, especially during activities. Look out for quickened pulse or dizziness, together with dark yellow urine or not urinating at all. Okay, next, wear a sports bra that gives lots of support to help protect your breast. Later in pregnancy, a belly support belt may reduce discomfort while walking or running. Okay, next, resist sporting activity that makes you too overheated. Temperature is important, which water intake helps, as does the appropriate clothing. Avoid being outside on very hot days, instead wait for it to cool down. Last, lying on your back for too long is not a good idea when pregnant, and neither is immobility or standing still. There is a large vein behind the uterus that, when compressed, can affect blood flow to the heart. Standing still, on the other hand, means that blood rushes to your legs and feet, causing a blood pressure decrease. Make sure that some form of physical activity becomes a part of your daily habits. It is completely up to you what you choose, as long as your doctor does not advise against it. Okay, you may wonder, are there any exercises you should not do during pregnancy? Any balance-related exercises are a poor idea, such as being outside on a bike or trampoline. You don't want to fall and hurt yourself or your baby. Even light contact sports can also prove problematic, as there is a risk of being hit. Also, be sure to give up any martial arts or boxing during pregnancy. Another activity to completely avoid is scuba diving, as the decompression that occurs together with gas bulbs in the bloodstream can be harmful to your baby. Stay clear of overly warm interiors too, like steam rooms, and avoid lying on your back once the second trimester is underway. Okay, last. Is exercise also important after giving birth? My answer is yes. After giving birth, you may encounter challenging mood swings that light exercise helps to compete against. Activity is also the best prevention for deep vein thrombosis, which women become more susceptible to in the weeks after childbirth. Furthermore, exercise will help you to start shifting that extra weight as you start to get back to normal. Thank you for watching. See you soon.